RP is kind of a unique disease. It's a hereditary condition, and typically it starts out by destroying the retinal pigment epithelium in the periphery of the retina. It works its way from there to the center, and in the traditional methodology, in the traditional or classical thoughts about RP, is it results in tunnel vision, where the patient might only have a 5-degree central tunnel, and everything beyond that tunnel is not functional. Actually, there's two types of margins in retinitis pigmentosa. One we call a steep margin, which is exactly like the classical approach. So the patient has no peripheral vision, and the vision essentially constricts right to that tunnel, and anything outside of that 5-degree area they can't see. Frequently, the vision within the tunnel is pretty good. They'll sometimes see 20/20 vision, but only see 1 or 2 letters at a time, and certainly not see well enough to be mobile to walk around without bumping into walls and other people and tripping over things on the floor. So in those instances, we try to expand their field of view, sometimes as much as 300%. So in those instances, we can have them walking around and being mobile with a greater level of safety. And we can also have them seeing more characters. For instance, instead of seeing 2 or 3 letters at a time, they might see 2 or 3 words, which greatly increases their efficiency to function as far as reading and computer and those types of skills. In a patient with a sloping margin, they have central acuities that are still fairly good, and they have surrounding acuities that taper. So the further away from the macular center we go, the less sensitive the area becomes. However, by utilizing those areas, we can expand the field of view substantially by increasing magnification. So where a patient with a steep margin wouldn't benefit from magnification at all, because they go from seeing 2 or 3 letters down to seeing maybe 1 if they're lucky, a patient with a sloping margin benefits greatly by magnification, because by taking advantage of the areas surrounding the macula that have a lower level of sensitivity, we can then increase the width of the field through magnification. So in those instances, we get a good benefit from magnification and a very, very nice benefit to the patient.